Dr. Jordan, how would you describe the healthcare situation in New Orleans 2 years after Katrina?
Well, Katie, I think our healthcare situation is dire. It was dire immediately after the hurricane, and it continues to be dire. We have a crisis of access here. We do not have the infrastructure that we need. We do not have the number of hospitals that we do need. We do not have the coordination of care after people are seen in the hospital, and then preventive medicine. We have a crisis of access here, and it's both on the med-surgical side as well as psychiatric and behavioral health.
When it comes to regular medical care, tell me, how long is the average wait to see a doctor in this town now?
Well, that can be anywhere, and again, it's dependent upon volumes, and volumes change. They undulate, just as need undulates. But you can wait anywhere from a month and a half, 2 months to get a regular appointment, given that that doctor is willing to see you. Because remember, there's that much demand and that much resource. Okay?
When you say that much resource, is that because so many doctors have left New Orleans?
That's it. That's exactly the reason. We've lost about 54% within the parish of Orleans, the metropolitan area, the city itself. We've lost about 54% of the physicians that were here prior to the storm. Now, physicians and leave, that's certainly one issue, but the big problem is the lack of nurses. We still have, and nationally, we have a nursing crunch in this country, but certainly in this area, it's at a critical point. We don't have the nurses to be able to take care of the patients. In fact, I've quipped occasionally, doctors I got, it's the nurses that I need and the technicians and the support personnel to take care of the patients both on an inpatient basis and on an outpatient basis.
How do you get them to come back?
Well, in order for people to come back, to be attracted to come back to New Orleans, there's certain things that folks have to have. Would you move to a city that didn't have a school system that worked? Did you educate your children? When you have a crime wave that's ongoing and continues to kind of perpetuate, and there doesn't seem to be getting any better, a criminal justice system that's broken, was broken before the storm and continues to be broken. Those are the kinds of things that contribute to quality of life. If you don't have a quality of life to attract someone, would you move there?
Why did you stay?
This is my home. This is my home. I grew up here, and there's absolutely no way that I'm just going to turn it off and leave it.